An Oahu judge awarded more than $1 million to the family of an inmate who took his own life at the Halawa Correctional Facility. The family's attorney says it didn't happen because of a lack of policies, but rather the rules were ignored. As KITV4's Ali Iduklo reports, the state-admitted prison employees neglected the inmate.
28-year-old Joseph O'Malley's adoptive father, Michael, describes him as a funny, loving young man who sometimes rescued animals.
But he suffered from significant mental illness, which got worse as he became an adult. That wasn't his fault, any more than having a broken arm is someone's fault.
Diagnosed with cerebral palsy at birth and later attention deficit hyperactivity disorder, O'Malley saw numerous doctors and psychiatrists for mental health treatment as a child. In 2009, he was arrested at age 20 after robbing a car with a fake gun. Between then and his death in 2017, he spent extended periods in the Hawaii State Hospital and was diagnosed with post-traumatic stress disorder and drug addiction. He also had a history of schizophrenia, experienced hallucinations, and attempted suicide. O'Malley ended up in Halawa Correctional Facility for violating probation, where he would reportedly cut himself often. Attorneys representing O'Malley's father say the staff would punish O'Malley by placing him in isolation, a violation of the Department of Public Safety's suicide prevention policy.
Providing appropriate mental health care for the severely mentally ill in our prisons is not an option, it's a responsibility. And in this case, they failed in their responsibility.
O'Malley took his own life while he was in what is known as an observation room in the facility's safety watch. The state admitted staff at Halawa did not supervise O'Malley adequately or treat him with the proper mental health services. Court documents also indicate staff were using outdated medication. Family attorneys point out state policy dictates if an inmate is so mentally ill they cannot be treated in a prison, they have to be transferred to a facility of higher care.
What was shocking is we learned that to the people that we talked to, they never necessarily even knew of that policy or remember that happening one time.
O'Malley's family hopes his story can shed light on the need for better mental health services for Hawaii's inmates. In a statement to KITV4, a representative from the Department of Public Safety says it has sound policy for the care and custody of inmates with mental illness. The department routinely reviews and updates all policies, including the inmate suicide prevention policy, which is in accord with national standards. Ali Iduklo, KITV4 Island News.